Okay, I'll call to order. The Wednesday, October 22nd, 2025 Board of Health meeting, 4 p.m. I think it's a little past 4, but let me read some of our hybrid participation person or via Zoom webinar. Pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law on March 29, 2023. This meeting will be conducted via remote means and in person, as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but it may be watched when the show is replayed on YouTube. Members of the public who wish to participate in the meeting may do so in the following manner. Either in person at the Roadblock Room located on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Mass, or via virtually by joining the Zoom meeting with meeting ID number 978-5440-3812, 429, and the passcode of 429004. You may also send any comment or question to publichealth@plymouth-ma.gov. It will be entered into record and as practical time permitting, be read and addressed by the Board of Health. At this time, I'm going to take roll call. Dr. Reed?
Present.
Dr. Potvin?
Present.
Amy Palmer?
Amy is trying to sign in.
Okay, we'll come back to her and note when she does sign in. Meg Payne? And that's it for now. Public comment. There are 3 items that we received from various constituents. On 10/7, we received an email from Chad Perry. It was shared to the board. Let me shut this off. We also, on October 8th, the letter from Paresh Patel that was also shared with the rest of the board. And on 10/10, we received a message from Holly Truville, which was also shared with the rest of the board. Do we have any?
Amy has joined us.
Okay.
Amy is.
Hi, Amy. We took roll call. Amy Palmer, are you present?
I am, thank you. I had some trouble logging in, but thank you.
Oh, you're welcome. Okay. And then, any questions on the public comment?
We might have someone on public comment. Someone's raising his hand.
Great.
John Sheen will say.
Is it the public comment time for tonight's meeting?
Yes, it is.
Okay, and now's the time for me to give it, correct?
Yes, you have
Okay.
about a few minutes, but we're a little flexible. Can you state your name and
Yes.
address?
I'm John Shenholzer. I live in Ashland, Virginia. I'm the advocacy director for American Veterans for Kratom Safe. And I'm here to just, talk a little bit about kratom and the value of the natural kratom plant products. And I understand there's a big problem nationwide with the dangerous chemical products like 7-OH, the adulterated products, the liquid products. And I'm also in recovery from addiction for over 43 years. And I the founder of Virginia's largest peer-run recovery community organization, but I'm also a harm reduction expert. But a long story short, for the last 15 years, I've seen thousands of people pivot from more dangerous drugs to natural FDA packaged products, FDA regulatory packaged products. And when they pivot from a 1 pill kills to a leaf product, to me, that's kind of a win. And then we deal with the kratom product, should it become one, downstream. And I'm a United States Marine Corps veteran, and I've been in touch with thousands of veterans nationwide that use kratom because they really can't get their needs met over at the VA. And then there's, tons of chronic pain people use this stuff. So, when you discuss kratom, I always encourage people, please get some education before you make a decision on banning kratom, because these other products need to be banned, but not kratom. Kratom is just too valuable for our communities. and for our people that need them to have access to them. And that's the short version. And if you do have any questions, I'll be happy to answer them.
No further questions from myself. Any from the board of other members?
I have a question. Do you or your organization have any information leaflets or anything like that that you could send us?
Absolutely. I'm surprised one of my colleagues hasn't sent you a ton of documents and scientific, studies and whatnot, but I will see to it you get that soon, like tomorrow. I'll send you all types of information and some websites. And there is over 600 scientific studies done on kratom, over 200 peer-reviewed. And it actually, just a little tidbit, FDA tried to ban it 10 years ago, but they couldn't because it passed the 1994 DSHEA Act, Congressional Act. It met the criteria for a safe product to have entry into the marketplace. So, and I do know there are some problems with it, but compared to the value, that they're kind of worth the problems we have with it. But yes, I will send you that. Thank you. Great question.
Great. We're just at the beginning of this process, so we haven't made any decisions, but we need information.
And we would also be delighted for your board, we do a 30-minute, PowerPoint educational session. We would love to do that for you if you would like to do that. So, at another time, of course.
Yeah. Thank you.
Any other questions from the board? Okay. Thank you very much. Are there any other public comments?
Yes, there's
Misty
Misty Brown.
Misty?
Mhm.
All right, Misty, come on in. And give you 3 minutes.
Hi, good afternoon. My name is Misty Brown, and I'm a loud and proud kratom advocate from Colorado. I just want to preface this and say that I am not paid to come here and advocate about how kratom has saved my life, but I would like to read y'all my testimony. From 2008 to 2019, I lived in the grip of FDA-approved pain pills, benzos, and muscle relaxers prescribed for my degenerative disc disease. For 11 years, chronic pain management fueled my addictions. It started off as a dependency, then slowly slid into addiction. In April of 2019, I was dismissed from my clinic after failing a required pill count. I was 11 pills short, and my usual drug dealers didn't have any pink Oxy-10s that I needed. Cut off from prescriptions, I turned to the streets. While searching for another pain management doctor, I slid into cocaine use. Then in June of 2019, while enduring cocaine withdrawal, I stumbled across the documentary A Leaf of Faith. That moment changed everything. The next day, I began my journey with whole leaf kratom, not synthetic 7-OH. Kratom quieted the relentless cravings, the voice that always whispered, one more pill, one more snort, one more escape. It gave me space to address the deeper reasons behind my addictions. I was able to slide my way out of chaotic substance abuse and misuse. I have not returned to pain management over 6.5 years. Today, I'm no longer trapped. I'm a functioning member of society again, a thriving mother, a tax-paying citizen, and a proud first-time grandmother. Most importantly, I am no longer a burden to my kids. I will be forever grateful that I found safe, lab-tested, whole leaf kratom, not synthetic 7-OH products. Now I share my story, knowledge, and the science behind it to help others facing addiction, chronic pain, anxiety, and depression. So I would like to echo what John said. You guys have to do your due diligence. You have to know how to differentiate between synthetic 7-OH products and whole leaf kratom powder. Whole leaf kratom is safe. Like John said, there's about 600 studies done on it. There is absolutely no studies done on synthetic 7-OH products. So please do your due diligence and take their educational course. It is free and is absolutely amazing that they will teach you how to differentiate between these products so that you can help chronic pain patients or those trapped in addiction in your community. Allow them to be able to walk into a smoke shop, get carded, ID'd, so that they could start their journey to recovery or find what alternative pathway works for them for their chronic pain. Thank you for this time for allowing me to testify.
You're welcome for your public comment. Thank you. Any others?
See that anybody else has raised their hand?
We will-
Nor do I see anything in the
Hello?
chat requesting to speak.
Someone saying hello.
Who's,
I'm
Hello?
here.
Yes, are you?
who's speaking?
Can you hear me?
Heidi, something?
Yes, we can. Are you
Okay,
asking
great,
for some
great.
time for public comment?
I am. And
You
I actually had to be in the car.
Excuse me. Can you say your name and your address?
Of course. Of course. This is Dr. Heidi Sikora, and I live in Wakanda, Illinois, and part-time in Wisconsin, and that's because of Kratom. But I am a retired nurse practitioner and healthcare executive and a Kratom educator and advocate. And so, and I'm sorry that I'm a little, not good with the technology because I unfortunately had to be in the car and it's not as easy. But anyway, I've been taking Kratom for more than 7 years now for multiple rare painful disorders, including a Chiari malformation, tethered spinal cord, Ehlers-Danlos, and I'm also very sensitive to all pharmaceuticals. So Kratom is the only thing that has actually reduced my pain enough to be able to exercise and stretch. And that has been absolutely pivotal in my being able to recover and rejoin life. So I actually work with John and Laura, and I'm a volunteer, and we do the education. And I'm sure that I know that Laura sent you a packet of information. It sounds like maybe everybody didn't get a chance to review that, but I would encourage you to go ahead and take a look at that. And if you did not know, the FDA did a single ascending dose study in 2024. They finally have published those results. And that showed that Kratom is safe at all dose levels. And it laid the groundwork to do a human abuse potential study. And Kratom also passed the 8-factor analysis and did not rise to the level of scheduling. So, but for the single dose ascending dose study, they actually went up to 12 grams of Kratom, which is just a tremendous amount of Kratom. And the only side effect was nausea. So the powdered Kratom whole leaf products are very safe and effective for what people are using them for, which for myself, it's pain. And obviously there's a lot of people that use it for opioid withdrawal symptoms and also PTSD and anxiety. And I am here to answer any questions as well.
Through the chair, if I could just ask one
Yes.
quick question. Are you referring to, hello, I'm Karen King, Director of Public Health here in Plymouth. Are you referring to information from Laura Romney? Asking us if we
Correct,
received.
yes.
Okay, we did receive an email from Laura, that was on Monday, October 20th, and that was forwarded to the board, but it was just an email. It wasn't like a
Okay.
packet of information or anything. I just wanted to let you know.
Oh. Okay,
Yeah,
she didn't send you a lot of attachments.
No.
Well, thank you for your public comment. We're gonna move on with our agenda. We'll close public comment
Oh.
for now.
Are you
I,
kidding me?
and I will have, through my chairperson's announcements, some announcements around this topic. So I think there'll be plenty of opportunity for further public comment in the coming, weeks, as we work through this process. Next on our agenda is the approval of minutes. Do we have any minutes?
I don't
No.
believe so.
Okay,
no.
so we'll move on. To the next agenda item, chairperson's announcements. So as you see, we have a lot of dialogue on Kratom. Just recently, I mean, I didn't really know much about it personally, or since the last couple months. But there is dialogue on it. And really from my perspective, we're gonna have to understand the what, the product, the how, the actions, the process of it, and the why, with, some of this deeper emotional levels of the product called Kratom. To that end, we are planning on having a public forum in November. We're gonna talk through that and probably new old business, but we're gonna talk through that and kind of choose a date, floating out there, and then we're gonna, have speakers.
Mhm.
And you'll get on a list. It's not gonna last for 5 hours. It's gonna be time limited. We're gonna have requests to speak. You'll be time-based, and then we'll put you on the agenda for the public forum, and we'll go from there. It's a forum. It's fact gathering, information gathering. It really fits in with our board's goals of awareness, education, and community engagement. So more to come on that. And you'll see more of it advertised on the Plymouth website and et cetera. So that's the gist of, the other announcement I had was we do have an opening on the Board of Health for a member, alternate member. There is a remaining term, a 1-year term that needs to be filled. It's going to be, I think it's already probably up on the Plymouth website to apply. So if there's anyone who's interested, if any people on the board have a context that they'd like to, point them in that direction to really be part of the board. And then I know personally myself, I started out as an alternate and I became a full member when a position opening came up. And then now I'm part of the leadership team as chair and vice chair. So I really appreciated that whole kind of process of moving along the understanding of board of health operations, for lack of a better term. So that's the end of my announcement. I think we'll go now to perfect timing, grease trap variances.
Yes. So first one we have up is Plymouth Harbor side. So I did see Daniel Scoto here. So this one, I went out with the sewer division as well as engineering. They were great to work with. Daniel and his team did everything that we asked. They are asking for a variance to increase to a 2,000 gallon grease trap. They currently have a 1,500 gallon grease trap. Due to plumbing regulations, we did ask that they also install a passive grease trap inside of their kitchen, which they have done. That was just inspected and passed today. So as far as our requests go, they have met all of them. They will be cleaning the external one on a quarterly basis and the internal one on a monthly basis, both of which will be done by professionals as required by the town of Plymouth regulations. So the division does recommend that this variance be approved, and Daniel is with us if you'd like to ask him any questions.
Does the board have any questions for Daniel or the Public Health Division? Okay. Daniel, did you have any comments that you'd like to make?
No, everything seems to be in order. We've done everything that asked of us. Yeah, that's really it.
Okay, thank you, Dan. Can I get a motion to approve the variance as recommended by the Public Health Division?
I so move.
Can I get a second?
Okay.
Okay, with a first from Dr. Reed and a second from Meg Payne, any discussion? Hearing none, take the vote. Dr. Reed,
Yes.
Dr. Potvin,
Yes.
Amy Palmer,
Yes.
Meg Payne,
Yeah.
myself, yes, unanimous. Okay,
Thank you.
you're welcome.
Thank you.
Thanks, Daniel.
Tanya. Okay, so the next one we have, just make sure everybody's muted. The next one we have is for Second Wind Brewing Company. I don't know if he is here with us or not. However, they're going to be going in. They haven't even quite opened yet. They were looking for a variance for not having a grease trap on the bar sink and the bar dishwasher. However, they will have a full automatic grease trap on the sink and the dishwasher in the kitchen. So really the only variance here is for the bar. We have passed these variances before. We do check the drink menu and make sure there's no kind of fog that will be going down those drains. So the Public Health Division does recommend that approval for variance.
Is there anyone from Second Wind Brewery on the line? Hearing none. Any can I get a motion to, oh,
So, the bar serves bar food though, or?
Yes, but the bar sink, it's not a 3-bay sink, it's usually a very small one. And they just dump
Okay.
ice cubes or drinks or something like that down it. Food does not go down that.
So that you're
It's too small.
pretty sure.
Yeah, it's just not feasible because
Yeah.
they have to, you can't do dishes in there.
Right.
And if anything goes in there, it's usually just glassware. And they have a very specific glassware dishwasher, usually right next to that bar sink.
And not that I'm an aficionado about drinks and cocktails, but aren't there some that have cream in them or stuff like that?
So I had to be schooled on this as well.
Oh, there you
I
go.
guess they don't make things like White Russians anymore. I wasn't aware.
Oh, that's it. Go order.
I guess it's not what gets ordered these days, so that's why, like I said, we do go over their drink
Okay.
menu to make sure. If we saw things on there like, the Oreo cookie mudslides, things that had
Yeah.
ice cream and whatnot, we would probably say, I don't think so.
Okay, but you thought it was good. Okay.
Yeah.
Thank you.
yeah, those
you.
days at Studio 54.
Yeah.
Over. Dr. Reed.
Showing my age, okay.
Miss Amy Palmer, did you have any questions for the?
No,
public
I
health?
don't.
Okay, thank you. With that, can I get a motion for, to recommend the variance as recommended by the Public Health Division?
I said, but.
Okay, can I get a second?
Yes.
All right, with a first from Dr. Reed and a second from Meg Payne, is there any discussion with the board? Hearing none, I'll take the vote. Dr. Reed,
Yes.
Dr. Prockman,
Yes.
Amy Palmer,
Yes.
Meg Payne,
Yeah.
and myself, yes, unanimous. Thank you.
Okay, the next one on the agenda is for the Gillis Family Tavern. This is the second time it's coming before us. I don't see that there is anybody online to participate. This is kind of at a standstill. We still don't really know what they're doing. They have reached out to us to ask what size it is, and also the owner of the building itself has reached out to me to ask. So we're still not really sure. I would say, and you can correct me if I'm wrong on this one, I would say we do not make a decision of any kind today, until we have some more information from them. That was what I believe the agreement was the
Yep.
last time they left it.
Yep.
Amy, did you have any questions for the Public Health Division? Anyone here on the rest of them? I do have a question.
Yeah.
Is there, so the process they're trying to go through this variance and is there a fine schedule right now, or is that, what's that looking like?
So there is a fine schedule. They have been assessed the fourth one.
Okay,
So at this point, it's kind of the make or break
right,
point. If they do not have it, and we have started taking legal action for some of the establishments that have not complied to date. So I would like to at least try to get them through the variance process.
yeah.
And get them the benefit of the doubt before we go that route.
Okay. We'll keep an eye on it and we'll table it for next time. Thank you.
Okay, and then the next one is Seaside Ice Cream. I don't know if anybody is here for that.
Yeah, we're here.
Oh, you are? Okay, great.
Come on
Hi,
up.
come on up. Jennifer?
Yeah, that's me.
Hi, Jennifer, I'm Margaret. So our team did go out.
Can I have a
to,
seat?
Visit Jennifer's establishment up on North Street, up in North Plymouth on Port Street. They do have a grease trap now. We are fine with them keeping that. The only stipulation, just to be in compliance with the regulations, is that they get it cleaned monthly. And you are seasonal, right? Yeah, so, and they're seasonal, so that's why we're fine with it, them keeping the passive, so long as they do comply with the regulations of having it cleaned by a professional on a monthly basis.
So that's the recommendation from the Public
Correct.
Health Division. Okay.
Correct.
Any questions for the requesters?
I do have a question.
Sure.
Is there anybody you could recommend, or how do I find that
The cleaning-
information?
Sure, I can send that
Okay.
information to you, of
Okay.
course. Yep.
All right.
Amy, do you have any questions for?
No, I don't.
Okay. Anyone else?
Yeah, I have a question. What is something like that cost? I'm just curious, like a monthly cleanup, like.
I'm not sure, to be honest with you. I do not know what it is because everybody's a little bit different depending on the size, depending on, some of them have like just a flat rate if it's under 100 gallons or I'm sorry, 100 pounds. It really all depends on the size, the company, how far they have to travel. There are a lot of local ones that do tend to work with other small businesses that I will be able to give you the names of. So I'm not really sure of the exact price of it.
All right, well, with that, I'll entertain a motion to approve the recommendation from the Public Health Division.
Yes, I'll move.
Second,
I'll second.
with the first from Dr. Reed and a second from Meg Payne. Any discussion? No. Take the vote. Dr. Reed,
Yes.
Dr. Potvin,
Yes.
Amy Palmer,
Yes.
and Meg Payne. And myself, yes, unanimous. Thank you.
Thank you, guys.
Thank you. I'm just gonna send these over. Sign them and get
Yeah.
convenience.
We're doing that. No, DocuSign. Doing paper. All right. All right, so I think,
We're having problems with computers these days.
do this real quickly.
There's something more. Oh, no.
The next on the agenda is the septic variance request. So maybe we could tee that up. Who's next? 26 Boot Pond Road is the first on the agenda.
Well, I'm gonna try to
That's me, right?
get it.
Also I have, the, plans to check the application.
Oh, yes, I think I get the $75. Yes, thank you so much for that. Appreciate it. Okay, you're gonna have to bear with us because we're having some technical
I
difficulties.
have, I brought a plan.
Poster board?
Yeah, poster board, I can put up if you want.
Absolutely.
Yeah, and I can try to. There we go, I got it.
Oh, you have it up there?
Yeah.
Okay.
It's a little pokey, but we'll try our best. We might still need your board.
Just.
Yeah, thank you. Yeah, I'm clicking stuff, it's just not
Oh.
moving.
It's clocking. As long as we're not on AWS.
What is that?
You don't wanna know.
Yesterday's outage or Monday's outage.
Okay, yeah, there's a little something. Thank you.
I guess I'll start from setting this up. Jack Sargent with Outback Engineering, here to represent our clients at 26 Boot Pond Road. And we're here to request some variances, two variances for a proposed septic system. So we have an existing 3-bedroom house. And what we're requesting is a reduction in the buffer from the septic system to the wetlands from 100 feet to. Sorry, a reduction in the setbacks from the septic to the border vegetated wetlands from 50 feet to 40 feet. And a reduction in the setback from the system to the existing well from 100 feet to believe we have it at 60 feet now. Where the house is and where the existing well is and where the wetlands are, you really can't get it farther away from the well than what we're proposing. Wetlands we have a stone fence proposed along a 35-foot buffer. It's already been approved by the Conservation Commission. And, that's sort of what I have.
So two variances that you're requesting. Did-
And then the other ones as well.
One has already been approved by Conservation Commission, the
Okay.
setback.
The set, the
Yeah.
50 to 40?
Yeah, that's
Okay.
already been approved by Conservation, so the board's considering the setback from the locust well from 100 to 60.
Is there,
We would recommend.
recommended?
Mhm.
Okay. Are there any questions from the board?
It's replacing the accessible.
Okay. Wonderful.
Yeah,
Yes.
I have the usual question.
Yeah.
Do you have you done well water testing to make sure the well water is potable?
I'm not sure if it's been done. We can have testing done.
Because it's, if there's a cesspool particularly, there's some risk. I think it would be wise to do that.
Okay.
Do they have a test? By the
No,
way? But-
we're, on our
Is it-
paperwork, we recommended that a test be done for the homeowner.
Okay, so you'll have that
Yeah.
beforehand, okay. Amy Palmer, any questions?
No, I don't have any questions. Thank you very much.
Okay. Rest of the board? No? All right, I'll entertain a motion to approve the recommendation for the variances, the variance as recommended by the Public Health Division.
So move.
Can I get a second?
Second.
So the first from Dr. Reed, a second from Meg Payne. Any other further discussion? No? I'll take the vote. Dr. Reed?
Yeah.
Dr. Poppin?
Yes,
Amy Palmer?
Yes.
Meg Payne?
Yes.
Myself, yes, unanimous. Thank you.
Great, thank you.
So the next is 25 Center Hill. Right, this is revisiting the Grady Consulting.
Right, so 25 Senate Hill Road were here, they were, I don't know if they're here right now, because I told them that I would present. They came before us and then we asked them to go back and resubmit with a 25% reduction because of the butter situation. So they have indeed done that. So now they're coming back to us today. They have been approved by the Conservation Commission. And they're asking just for the 25% reduction in the design requirement. And which would result in the 5 feet from the property line, which was smaller before,
So it
so.
used to be 1 feet. I think they were talking and then we moved it by the 25% reduction and moved it further
That
away.
still has to be approved by the board. They did what we asked them to do, but now you have to approve what they did.
Okay, good, good.
Yeah.
Are there any questions? Amy Palmer? Yes.
I guess I have to ask the question to you. This is a cesspool again, the existing system.
No,
It's not.
no. This was, let's see, No, it's just an upgrade, a repair and an upgrade.
Okay. The other question I had, it looked to me like the well was designated as being in the basement of
It
the
is.
home.
It's not unique.
Oh, it's just
We got those.
those, okay,
Mhm.
thank you.
Yeah.
Amy, did you have any other questions? Okay. With that, can I entertain a motion to approve the recommendation of the variance from the Public Health Division?
I so move.
And a second?
Okay.
Thank you. With a first from Dr. Reed, a second from Meg Payne. Any question, discussion? Hearing none. Dr. Reed, how do you vote?
Yes.
Dr. Poffin?
Yes,
Amy Palmer?
Yes.
Meg Payne?
Yes.
And myself, yes, unanimous. Thanks. Do that. I thought that was a good compromise, that whole played out.
Thing.
We had, when we had the abutter come in and they
Yeah.
made their discussion and
Yeah.
the, you know, the.
And they
submission.
reached out to say that they were pleased that they were able to do that.
Oh, they did reach out, that's great, yeah, so I thought that whole process
Yeah.
worked well. Well, we're a little early, we're moving on, so, we had a presentation on the topic of the du jour, kratom, with Katie Marie. I'm not sure if she's on the line, if she could do her.
I don't see anybody named Katie.
Okay,
I think she was planning on coming in for at 5 was when we told.
Yeah, we're a little early.
yeah, so we'll move on to, the next topic, and if it's fine with the rest of the board, if we can move to the director's report.
Sure, I don't have anything to put up on the screen because we're, as we all know, we're suffering from technical difficulties here at the Plymouth Town Hall.
Oh, it's still ongoing,
It's still ongoing,
okay.
yeah. So a couple of things though, I do wanna, talk about. I have received today many emails regarding kratom. So some, folks, I have taken them out of my pile because
Yeah.
they came through public comment, but there are, several others. So I just wanna let you know that I received them. I can read them if you'd like me to. We can hold off on it till we have the forum. Perfect. So moving along. We should probably talk about the, speaking of kratom, let's keep on that vein. Did you wanna talk about the dates at this point for the public forum?
Yeah,
Okay,
I think I printed out the email that you had at the Great Town Hall.
yes,
was
the Great
open,
Hall,
the
yeah,
Great Hall.
yeah.
So the question is, I think the dates that you mentioned were November 12th, 13th, 19th, or 24th.
Right.
So if people can put up their calendar, on their phone or whatnot, members of the board, and just kind of take a look at that, because clearly the further down, like the 19th or 24th, you have a lot more time to get input from, you know, who's gonna present, gives us some time to advertise it through Casey Kennedy and that process. And so,
Can you say the dates again?
yeah, the 12th, the 13th,
So the 12th is a Wednesday, 13th is a Thursday,
19th and 24th.
19th is a Wednesday, and the 24th is a Monday. They'll all be from, I believe, what did we, I forget what time I requested actually, Lorenzo. I can't remember what time I
Yeah, it
requested.
wasn't listed.
Yeah, let me find my request.
So the 24th is the week of Thanksgiving,
Yeah,
right?
that does not.
Yes.
Okay,
Yeah,
And the 12th and 13th don't work for me.
okay, so how's the 19th?
I think the 19th is
The winner,
That's good for me.
okay?
Amy.
Yeah, but in a different room.
It'll be in the big room,
Yeah.
you know, with even more comfy chairs.
Now I think I had them block out, anything after, 4. So I guess it's up to the board to decide, but usually like a 2-hour chunk of time, for a forum, so whatever 2-hour window you'd like, then I can put that request in too.
Sure. What time? Amy, anything after 5?
5 is better for me, especially on a Wednesday, but, yeah. That would work for me.
Okay, 5 to 7?
Okay, so let's keep in mind a couple of things, just
Okay.
as we're talking about this, okay? Currently, the Board of Health would have their meeting on November 5th, Wednesday, November 5th, and Wednesday, November 19th. November 5th, you most likely will not have a quorum.
Right,
We will be at, the Massachusetts Health Officers Association Conference. So I don't think it makes sense to have a meeting on the fifth because no one will be here. So you could talk amongst the two of you,
Right.
but it really. You can't get business done per se if something required and.
Right.
Yeah.
So that being said, the other date that it would be a Board of Health meeting would be the 19th. So one recommendation I can make is this. We could do a 3-hour chunk where the first hour is our traditional Board of Health meeting
Mhm.
and 2 hours dedicated to the forum.
I think that is better.
Or we could do. If we could move the 11, because the 11:05 meeting is virtual.
Oh, I
we move
see,
that-
okay.
If we move it Tuesday, and it's really, we try and focus not having anything to vote on in that meeting. It's just really updates and presentations.
We'll be there on the 4th.
Oh, you guys will be there on the
Yeah,
fourth?
or the- yeah.
Do we need it at all? If there's nothing to vote on?
Well, we have updates for like the appointments.
Yeah.
You know, so anything, and if we have any other presentations that we want outside of Kratom or, and you know,
Mhm.
because we're having the forum. But that was the intent of going to 2 meetings a month. The first meeting having just kind of presentations, updates,
Yeah.
discussion about anything, you know.
So Monday, the 10th would be the first time that we would be back from the conference that we could do a Zoom.
Okay.
Keeping in mind the 11th, we're closed
Yep.
for Veterans Day.
Yep.
So, but other than that, we can make that work.
Does that work for everyone? The 11:10, the
It-
Monday?
I can do the 10th.
Great.
Is this room available for the meeting?
Virtual?
It's virtual.
It's virtual,
It's virtual.
Yeah.
Yeah,
purely
The
virtual.
10th is virtual.
yeah.
5 to 7.
Hmm?
5 to 7.
5 to 7.
So it's November 10th.
So that's in place of the 5th, November 5th, regular.
Right, it'll replace it.
Okay, so that moves us back to the 19th.
So, hey, I just double checked my calendar. So I'm available 5 to 6 on the 10th. Which we can probably get our business done 5 to 6 and then
Yeah.
I'll miss the 6 to 7. Sorry.
Okay.
Okay, so we're going virtual on Monday, November 10th.
Correct.
Okay,
5 to 7.
5 to 7. And we know that Amy has to leave at 6.
Right.
Okay, okay. That answers
Thank you,
that question.
guys.
And so leaves us for the forum.
Yep, just the forum, unless you want to still do the 3 hours and do the,
What time did we decide? 5 to
we
7?
haven't.
Oh.
Because I was making a recommendation that you still hold your Board of Health meeting
Right.
part, the first hour, and then the forum 2 hours after that. Because the second meeting would be variances and things like that, and I
Yeah.
could also. We could gauge what's going to take an hour, you
Right.
know what I mean? If we got to that point, I would say no more for this month. You know, maybe we would have to wait to the first one in December,
Mhm.
so
That makes sense. I would vote, I would not vote, but I would suggest a 1 hour and then a 2 hour forum. And if the forum really, based on the kind of interest that we've seen in the past few
Mhm.
weeks, month, it might take the full 2 hours. You might have a full
One
slate of,
hundred percent,
don't you think?
100% you
Full
will.
slate of
Yep.
people, even from maybe even Devin can present because she sees a broader picture of some of the things that are
Yeah,
happening.
you'll fill in the 2 hours,
Okay.
yeah, for sure.
Are there any
So we're doing the.
comments or suggestions on that?
The
the
19th,
board?
the first hour.
So Lorenzo, are we saying that on the 19th, we're gonna try the 3 hours instead of the 10th, or the 1 hour on the 10th and then 2 hours on the 19th?
We are gonna have a meeting on the 10th from
Okay.
5 to 7,
Got it.
Virtual.
virtual. And
Yeah,
then we will have a meeting on the 19th, 1 hour. And then a forum on Kratom that will be 2 hours.
okay, so I would recommend the meeting from 5 to 6. Amy, that 5 works for you, right, Amy?
That works well for me. Thank you guys
Okay.
for accommodating my schedule.
So 5 to 6 for the Board of Health meeting, which we will
Okay.
obviously post an agenda for,
Mhm.
and then 6 to 8. Would be the forum, which also needs to be posted, so, but that gives us plenty of time to do
Yeah.
that too. Okay.
Yeah, this being it gives us a month,
Mhm.
almost a month, so
Mhm.
that's good.
So that, sorry, I'm taking up so much time, but,
No,
so the 10th. Would mean that you and I would usually get together on the Thursday before,
Mhm.
and again, I'll be at the conference,
okay,
so we'll have to think about that.
yeah,
Mine will be-
whatever,
Okay.
however time, we,
Okay,
I'm
we'll
flexible.
figure something out.
To wherever, if you're attending any breakouts or whatever, if you have time to carve out 30 minutes just to
Alright,
do the thing, or we can even do it via email.
okay.
That we go back and forth with the draft template, and then we'll go back and
Yeah,
forth and
yeah, that's good
discussion.
too, yeah, okay. Alright, so we're good, so we have virtual Monday, November 10th, 5 to 7, regular Board of Health meeting. And then we have on the 19th, 5 to 6, Board of Health meeting going into 6 to 8 for a forum regarding kratom.
Right.
Alright.
I
Excellent.
already know that we had some, Michelle and HRA wanted to do a presentation on the 5th. I'll just tell them to push it to the 10th.
Perfect.
I'll
I
mention
think,
it
I
to
think
them.
she'll like that better anyway, because she didn't like some Tuesdays, because you never know when you're gonna get called before the select board.
Right,
And you
right.
have to be writing on Tuesdays at
Exactly.
a moment's notice.
Okay.
Okay, so the other thing, oh, before I continue, is Katie here? I don't wanna.
No.
All right, I'll continue. So, we're starting our budget season, so yay, so, just to let everyone know that's happening, so, Margaret and I are working, and Dana's obviously helping us a great deal with administrative stuff, so we're working on our budget. Our town manager has requested level funded, budgeting this year, which means we can certainly do things like contractual salary increases, but not a whole bunch of anything else, so, that's what we're working with. And then, I don't know if, everyone's aware that the select board is doing what they call, on the road select board meetings, where they travel, to different parts of the town. So their next visit is to West Plymouth. So they're asking all kinds of boards and committees and groups if there's anything that you would like to bring forward as a topic that is concerning to you that is in the West Plymouth area. Hi.
I know we're supposed to be here for, the health department,
Right.
Gillis's family cabin.
Oh, okay,
Back on the 22nd.
right. That was, that happened at 4:20.
I didn't realize that, I
Okay.
didn't even think today was Wednesday, I was thinking it was Tuesday, today is Tuesday.
Okay, so if you wanna come in, we're just finishing up on something and then
Yeah.
we'll tell you that you have more things to do. So if there's anything that, you can think of that you'd like, them to discuss. Now, keeping in mind, on the road show, is really open for people to come up to the microphone and ask anything they want. And then unlike public comment, where the select board doesn't necessarily have to answer public comment at the select board meeting, this really is more of a give and take. This is, people ask questions and the select board has a discussion about what that question was. Moving forward, now they're thinking about reaching out prior to having these to see if there's something of interest with our boards and committees. So, I just lost the date of that. I forget which one it is now.
Okay, sometime before.
Is it November 4th? So if anyone wants just to send an email, to Margaret, and let Margaret know, if there's anything that you would like, or you can even send it directly to Michelle Brabby, who's the Commissioner of Health and Human Services. To let her know what, anything that you would like to, hi.
I would add, there is something
Yes,
that
tell
I
me.
would like, the, West Plymouth Recreational off of South Meadow Road does not have an AED at the complex. That was just something that I was thinking about,
Oh, okay.
Because there's one at West Elementary, I'm a soccer rep, so
Right.
they like to have one on site. There's one at Forges Fields, there's one at West Elementary where certain games are held. There's not one currently at West Rec.
Okay, well, you don't even have to bring that before the select board. I will reach out to the person who's in charge of Parks and Rec and we will address that.
Awesome.
Yep.
Thank you.
Yeah, maybe it's budget season.
Wow, yeah,
Some
hello.
line item, or whatever it costs, you know, I don't know how much those things cost, $1,000, $2,000.
So that's at West Plymouth Rec?
Yes.
Okay. All right, I
Thanks,
will
Charlie.
reach out and let Ann Slesser is our recreation director, so I will definitely let her know that we need an AED there. Okay. All right, that's awesome. Look at that. We did that. Okay. And then just as a final note, I will be out of the country starting tomorrow until November 4th. So should you need any
Fun.
yes. My husband turned 60 and our kids said to me, let's take dad to Ireland. So we're going to Ireland.
Nice.
So Margaret will be here in my absence. Then when I come back, of course, we'll be at the conference, but definitely reachable. So after November 4th, I'll be back. So definitely reach out to me at any time after that.
Fun.
But Margaret's your delegate.
Margaret is, Margaret's the one.
Person.
Yeah, Margaret's my
Where's my
person.
number?
Lose your number and lose your email.
Margaret-
It's gonna blow up.
That's
It's okay.
Margaret's my person, and of course Dana, always in case anything administrative comes up. And that's all I wanted to discuss tonight.
Okay. Any questions from the Board of Health members?
No, I don't think so.
Okay. So I think we addressed new old business, but it is our agenda item, and then we'll revisit. Sir, I'm sorry, your name?
Jimmy, excuse me, Jimmy Gillis.
Jimmy Gills, we'll address that. So we talked about the Board of Health meetings, we have that pretty set. The timings of and everything there, are there any new or old business that a Board of Health member would like to bring up or topic? Amy? No, okay. With that, we'll go back to the grease trap variance, I believe we had this tabled from the last Board of Health meeting. So if you wanna come up here, is there a?
Yes, well, it's pretty much resolved.
Okay.
So I don't know if the landlord of my building, Dave Stamish. He made it sound like he was gonna reach out to you, but.
He did.
He did reach out to you. Okay, well, he agreed that he was paying for it and taking care of it. I just knew we were supposed to be here, so I didn't know if there was anything I needed to know
He hasn't confirmed with me that he's going to be paying for, all he did was just ask questions.
Oh, okay, well, he confirmed it with us, and either way, we are going to do it, I just don't know if he has a phone schedule or what, I just came up here because I knew we were supposed to be here.
Okay, so have him call me.
Okay,
He-
that's what I figured.
Yep, have him call me to confirm that so that I can make record of it, and then that way, because we are now at the point.
No, I knew that, I told him that we were coming back to explain what our solution would be, and now there is a solution, and I believe, his brother-in-law is reaching out for a plumber, that he's also in town contractor.
So just have David reach out to me to
Yeah.
confirm that.
Okay, alright, so
Okay.
I'm good on my end for right now.
For the moment, yes, yeah.
For the moment, yes.
Thank you.
We have not taken any action.
Yeah.
as a
No
board.
legal action yet.
No, it should be done on time, he knows it needs to get done.
Okay, great, thank you.
Thank you. Appreciate it.
Right. It doesn't, we are a little bit early. It's 5 to 5, and we will have, waiting on Katie. So I'll ask a question. Charlie, have you heard of Kratom?
I have, heard of Kratom, just very briefly.
Okay.
Our biomed teacher talked about it
Oh,
a
really?
bit, freshman year.
And how do you, as a man within your network of folks, do you see it utilized?
No,
No, in high school or anything?
I have not seen it in
Okay.
high school. I'm sure if you could, it could be, like an opioid, but
Yeah,
I've not heard anything about it other than the FDA, which stated there's no evidence for. In favor of, this was a while ago,
okay.
no evidence in favor that it,
Hello.
Yes.
Yes.
I was just texting.
Oh, hello.
So thank you for that, Charlie. I mean, I did, just, full disclosure as well, since we're filling in some airtime here, but we'll get into, the presentation. I did speak to a sample of one retailer, convenience retailer that, and they sell kratom in capsule form, not, the can or the energy drink form that we saw from May,
May.
right? But they have capsule forms and they self-regulate. They don't, it's sold behind the counter and they don't sell it to anyone 21 or under.
Okay.
So I said, okay, well, self-regulate's great, so you understand that, and it's behind the counter, but you know, there's nothing. There's no teeth around that, it's self-regulating itself, but it's a data point. It's one, a sample of one from, so they're aware of it and they weren't aware of it in an energy drink form. So
Yeah.
they were curious to find, oh, really?
Yeah.
So
I can help.
more of that to come. I'm gonna reach out to them to see if they'll present at the forum from
Mhm.
that perspective.
that would
Cause
be
we wanna
great.
get all kinds of perspectives. And we'll go from there.
Excellent.
Meg, hi, did you want to introduce our next speaker?
Yes, happy to. This is Katie Marini, and we met, on the advisory committee for allied health, for Plymouth North. And, she currently serves as the director of nursing at and I know I am not doing you justice like whatsoever, but you're an author, you are so many more things than what I'm saying right now, and I don't, so I don't know if you wanna expand on.
Sure, so I've been a nurse since 2004. I have a master's degree in emergency management for first responders, so all about mitigating, planning, and avoiding emergencies in our communities. I was very vocal during the opioid epidemic. I unfortunately have been directly affected by addiction in this town, I'm a third generation townie. And I've never once been addicted to any single substance, yet my entire life has been pretty much derailed from the time I was a child, all the way up until right now, by substances. Actually, my 22-year-old son is gonna be here in just a minute. I told him he's gonna join us. So I did bring some copies of the book to hand out. I don't know if I brought enough, but, my sister passed away from a heroin overdose in 2014. And at that time, there really was no help to be offered. There was just really nothing out there. At the time I was working at Beth Israel. I'm still a nursing supervisor at Beth Israel in Plymouth, so in the off shifts, I supervise a hospital. I've done that for 9 years. We opened the recovery center in Plymouth, Bob Hollis and myself. There was nothing around like that to help people get some help. We started Plymouth County Outreach, which I'm sure you guys have heard of, that does the door visits after all that. So anyway, saw really there go from absolutely nothing available to what we have now, which is a huge improvement. However, seeing these being sold, and like I said, I have someone in my family who is now directly extremely addicted to these and is actually on methadone to get off of it, which is heartbreaking because this is being sold at Mobile for $40. And it's 13 to 30 times stronger than morphine, which is horrifying. So
Can you say what that is? So
I'm gonna go over a whole thing. This is a 7-OH.
Yeah.
Yes, so this is a Kratom product. Yep. And it's about $40 for these. It does have on the back all the states that it is illegal to sell it in officially now, thank goodness. However, I can tell you that these are so easy to grab in Plymouth. it's really scary. And the amount of help for people to get off of these is pretty much nothing. There's really no found way to withdraw off of these, so it's still very touch and go. Narcan will reverse it, but the withdrawals from these is extreme. This is not like a marijuana withdrawal. This is like convulsions, vomiting, you know, inpatient.
So what you're showing is that synthetic or leaf?
This is synthetic.
Okay, so
If you
there
walk
was,
in- If you walk into one of the stores though, and you say, give me your best kratom product, they're gonna give you this.
okay,
This is a byproduct of kratom. So what kratom does is when it's broken down in the liver, and I have links in all my
Mhm.
slides for these, it creates a byproduct. And that is the byproduct. They have figured out how to get it all together and sell it.
so it's synthesized basically, okay, okay.
Yeah.
And Katie also presented, to the Kingston Board of Health, and we know now that they've come through and banned kratom in the town. I know you spent a lot of time and put together like beautiful slides, but I know we only have 20 minutes for
Yes,
this.
I will go through them very quickly. Is that okay?
Yeah, no, I didn't move them on, if you could just go through your presentation, what you did, not the presentation, but just without the slides, I didn't have them, unless you have them,
I don't have them.
okay, great.
Okay.
She did send them to me.
Yeah.
I don't know if we can send them to the board afterwards,
Yeah.
or maybe.
Yeah, I will send
I
it,
know
Yeah.
she's.
If you want to, that's fine, it's, so, I gave you each a copy of this because I really think that for people who haven't been directly affected, and I'm pretty confident that most of you in this room have been directly affected with a family member or a friend or someone, but if you haven't been, I just want to tell you a little bit about what it's like to go through that with somebody and why this is important. You can have, in the back of it, first of all, there's pictures, so what happened was, this is my sister, this is my baby sister, okay? She was 29 years old when she passed away. She was 18 years old when she became addicted. There was no turning back day one, that was it. It started off with the pills in Plymouth. It was a huge insurge of pills around here, Percocet 30s, oxycodone, all of that. At the time, I was working at the hospital in an oncology unit, so it was these medications that are great. They help with pain, they really help our patients. But on the streets, they were going out there, and even to patients, they were being marketed as non-addictive. And the reason I think this is important for us all to remember is that marketing is important, and what people don't know can kill them. So there were a lot of people who used these incorrectly and became extremely addicted. We didn't know then, but we do know now that addiction is a disease process that happens in some people's brain different than others. That is a scientific fact, we know that. What happened with my sister was she became very addicted to the pills. This was someone who was beautiful, talented, had every dream of going on in her life and being anything other than a drug addict. What happened to her over 10 years is nothing short of a horror movie, and it's all in here. And we can say that we are 100% authentic, because if you look through the book, you will actually see her handwriting in here and her letters, which, let me tell you, if you've ever written a book, it's difficult to get someone's actual handwriting in print. But it's her words, they are not changed or altered. And it's what it felt like for her to go through that, knowing what she had put everyone else through. And knowing all of the obstacles that she was gonna have to face in order to get over the addiction. So it doesn't matter if it's alcohol, marijuana, heroin, but kratom products are so addicting, and it even says it on the packaging that it may cause addiction. If you develop addiction, seek help immediately. It's too late then. If you know you're addicted, it is too late. So then you're looking at, do I have insurance? Do I have money for, can I take time off of work? Am I gonna lose my children? Is DSS involved? Like, it spirals and grows out of control. What happened with her was there was a lifestyle, and this was very prevalent in Plymouth. I don't know if you guys were here around this time, 2010 to 2014. There was a lot of pills on the street, a lot. We were one of the biggest per capita in the nation. Her life went from someone who was young and was gonna go off to New York City and be this big editor. And I can tell you, in our entire family of 5 children, she was the smartest, had the best grades, and the one we worried the least about. She ended up being used as a mule from Mexico. She was raped multiple times. She had her nose broken in a hotel room. I mean, she was left in a closet for 2 weeks. This is graphic, I'm sorry, but this is the reality of it, and used for payment for drug dealers. By the time she was dropped off on the curb outside the hospital, when I happened to be working that day, she was dead. They saved her multiple times, brought her back to recover, only to fall back into it again. The spiral that this causes is so damaging to families that we have spent the last 10, 11 years since she passed, so it was 11 years in August, trying to make sure no one else has to go through this. My parents will never have her back again. Our holidays will never be the same again. We learned so much during that epidemic that to go backwards at this point is so insane to me. I just don't understand why we can just go to a gas station and buy these.
Can I ask you a question? The folks, there were some folks that talked about earlier that were advocates.
Mhm.
And they mentioned that the natural
Kratom
stuff
leaf. Mhm.
was okay. And it was just the 7-OH that they were concerned about, the synthetic stuff.
So the 7-OH, I will say, is so much stronger than the pure leaf kratom.
Yeah,
But the pure leaf kratom is not what they're selling in the gas stations.
well, right.
So
But-
that's a
but
whole
the pure
different.
leaf kratom, is that addicting as well?
It is addicting. It's not as addicting as this.
Uh-huh.
There's very limited research on it. I know that, I believe it's actually Indonesia has completely outlawed all kratom. All my links are in the slideshows, so I hope you guys get to see those after, but. The 7-OH, if we could just get rid of that, I mean, I personally would be satisfied with that as a start. But the problem with kratom as a nurse is that it's, no one's diagnosing or giving a dosage to use or safely monitoring its use. So what's happening is people are starting with kratom and then finding this to be a kratom product and moving right into this. And this is the true immediate danger. This is an immediate danger, not a slow gradual thing. It's gonna be very fast and hard.
The bands that I have seen around Massachusetts, I've looked at the different cities or towns that have done it, have all specified synthetic.
Yes.
They haven't talked about the other.
I don't personally know of anywhere where the other pure leaf kratom is actually sold.
Interesting,
Yeah.
interesting.
So I do believe, I'm sure there's healing properties to the pure leaf. I don't know. But again, I haven't even seen that for sale anywhere.
Yeah.
The other dangerous part about these is that because they are synthetic, they're not showing up on drug tests. So your kids or your family members can be taking them and they will pass a drug test.
You said one other thing that I think is important for people to know, just out in the community, and that is that Narcan will
Yes.
reverse it. So if you have any suspicions that your child who is laying there looking
Yes.
dead, took this,
Mhm.
then you need to give it.
Yes, and so what we have to know about these 7-OH products, and again, they are kratom products, is that they have 2 different lives. In a small dose, it's like meth, it's a stimulant, they're gonna be wild, crazy, psychosis. And a high dose, it's like an opioid where they're gonna be super depressed and nodding off. So you're gonna have 2 different effects from this depending on how much they take. The other thing that we're reading in studies, and again, there's not a ton of it out there and available right now, but is that it can build up in your system, so the more you take, you've already got that in your system, it's gonna have a stronger effect, and you're also gonna need more to get the high feeling from it. So, again, not being dispersed or prescribed or watched over, it's just very, very dangerous.
It's not regulated.
No, not this synthetic.
No.
What you wanna see?
The product that I hear the most about is those little blue drinks.
The Live Well drinks.
The Live Well, so
Yes.
like you said, with the marketing, like you think. Live Well as in doing something, good for yourself,
Sounds
or
good.
I talked to somebody as one of the schools too, and they were saying like. Kids will buy, like thinking this is like an energy supplement for like the gym
Mhm.
or
Yep.
something, and like that's how it.
A wellness
Like, introduce-
supplement, yes.
Yeah,
Yep, that's what they think it is. I've heard that a lot of college kids take it to stay up at night and to study as well, cause it's like a B12 supplement. That's what they think it is. It's just gonna give them energy.
The other thing that I find really concerning is like here, the amount per
Yeah,
use
I saw
dose
that.
is 1/4 of
I
a
saw that.
tablet.
Yeah.
So take the
And
whole
I-
thing.
Who's gonna buy this and take 1/4 of a tablet? Yeah, no one's gonna do that. No one's even gonna think that.
Yeah, well, and that's not even actually like safe to say, because as nurses, we aren't even supposed to cut tablets because you don't know what dosage is on what side of the tablet.
Right.
So it's something only a pharmacist is actually supposed to do. So to have the general public out there, you know, take a quarter tablet and you're fine, it's like,
Well, it's like,
what does that mean?
for me, it's always been concerning about the serving size, because even the drink, if you read it, it's like 2.5 servings. And it's like,
And it's a tiny
it's
little.
a tiny little, and it looks like a little energy drink, a little tower, like those 5-hour energy drinks.
The
It's
lip
like-
well.
It's exactly what it looks like.
I think it's concerning too that
It's
there's,
live well.
there's
Yeah.
nothing on there. You know, Narcan, we know is only effective on the receptors, and
Mhm.
that's why it works with
Yeah.
opioids. There's nothing on that to say what to do.
In an event of an overdose.
Exactly,
Yes.
there's no kind of warning, and the fact that it's just being sold like over the counter in convenience stores, when you need Narcan on hand to be able to use that, that alone tells me this should not be sold in convenience.
So,
stores like that.
all the things that I've read about this online, and I try to go to, you know, medical journals and things like that, it says that. This product alone, the only thing about it is that it may not cause the same respiratory depression as heroin or fentanyl. However, in everyone that they have collectively studied, it's polysubstance abuse. And I think the reason for that is because what you also find in the research is that they're marketing kratom products to help with withdrawals or to subsidize those. So it's really not helping. They're actually overdosing because now they have two things in their system, which is terrifying.
Right, so like if they can't get what they call well,
Exactly.
by
This
getting
is what it
the
looks
narcotics or
Yes.
opioids, and they're gonna use this as a
Yep.
quick pinch.
And it's gonna
LYV.
water.
Yes.
Yeah.
And Charlie, right?
Yes.
Yeah.
Where are you a student again?
I'm a student at Plymouth South.
What's that?
Yeah. Photos.
This is what it
Do
looks
you need
like.
anything like that?
It's a can like that. And it's LYV, well, live well.
Could you,
Not
is there,
LYV.
could it be turned over so I can see the,
Well, I
Oh,
did
there
there.
I think I've seen that.
Yeah.
I think I've seen
And
that.
it's. a
You've
drink.
seen it,
I think I've seen it. Yes, it's a drink. It's a.
yeah. You've seen kids drinking it too.
I believe so. It's
It's a pretty can, right?
among the energy drink mix that's going
It's
around.
so scary, like this is so terrifying to me, I can't even, like, the people that I know that I've talked to. This is so deceiving, I've talked to mothers who are like, I didn't even know that these were bad, I was buying them for my children. And then they became fully hooked and they're like, I mean, this is like a whole other realm of mental illness that we're just looking to unleash on our community. There's just absolutely no benefit to it that I can see. It's going to cause so many problems. I mean, just trying to get a bed to withdraw, I don't know if any of you have gone through that process. It is painstakingly difficult. It is not easy. And then getting someone to sign themselves in willingly is not easy. Then you have to look at sectioning them again, not easy. So this person, you know, is missing school, missing work, not handling their responsibilities, but then also whoever is trying to care for them is missing school, work, not handling their, this is how lives become destroyed.
So the intervention is really prevention.
It
Right,
is,
at the end of the day.
yes,
At the end of the
When you
yes.
look at that, for this specific things, and before you came, Katie, we were talking a bit. We're going to have a public forum on this topic. We're gonna advertise it and we're gonna have a list of speakers in November, I believe the 19th. So, you know, would love, we want to have perspectives from everyone, and really part of it is understanding the products,
Yeah,
right?
yeah.
You're talking 7-OH synthesized, you're talking leaf, which
may or may not act as a gateway, but it seems, we use that as a gateway to something more stronger.
Yeah.
But we want to get all the information out there on
I can
this.
tell you that at the Kingston board hearing,
Mhm,
just so we can kind of know maybe what to expect at that, they did have a number of Kratom supporters call
Sure.
in, and of course, I mean, there's going to be those people, right? There's always gonna be the supporters, no matter what you're pushing.
Sure.
But I can tell you that not one of them used Kratom successfully to get off drugs or pain medications. They're all chronic users. So if that is going to be the case, it should be something that is prescribed by a doctor, that is monitored for usage and safety. You know, you need to have a once a year checkup to make sure your organs are not being affected, that you are still safe to drive. If you're pregnant, can you continue to take that? I mean, there's a lot to consider here, and I think that we just know so little about this and what all the actual repercussions are going to be. I mean, the opioid epidemic was a whole thing that came and kind of hit us out of nowhere. Hundreds of thousands of people died, endless more, I mean, how many grandchildren now are being raised by grandparents? So many, the system is flooded. We really just can't afford as a society to be looking towards substances. We're supposed to be focusing on health and wellness.
Can you think of anything else in the past that has been marketed like that? Like so easily accessible?
I really cannot. I know that vaping was the last big thing that I can remember. I sat on the state committee of nurses when we were, working.
But
at
even
the
then, there were
campaign.
regulations that you had to be over
Yes,
21. There's
yes.
really nothing.
You are supposed to be over 21 to purchase these. And I know that in a lot of states, they have pushed for
But no one's looking at
laboring
that.
and things like that. No.
No one's making
Starting at
sure that
all.
that's happening.
Absolutely. No.
So there's
It
no
does
checks
say
and
that
balances.
front and
Yes.
back. It
Yeah.
says-
It's very.
So it
specific.
doesn't say on the package,
That can be
21 and
stolen so
over.
easily. too.
Right.
Yeah.
It doesn't say on the package that could cause an overdose and that can
No.
be reversed by
Right.
Narcan.
Right.
Yeah.
And it's exceptionally easy to steal.
Yeah, and it's shiny, it's attractive.
The
Oh,
dosage,
right.
what a serving size isn't that big. I mean, it's teeny tiny.
Yeah. Yeah.
Yeah.
I mean, I have a friend who runs a recovery center in Connecticut, and he came up with a symposium in September that was down on the Cape. And he messaged me that he was shocked. He's like, I can't believe you're selling Kratom products like right at gas stations up there. He said he saw like lines of people getting them. I mean, this is a huge problem unfolding right in front of us.
The statistics on the Cape are worse than here.
We wanna prevent that. We don't want that around here.
This way.
Yeah, it's definitely coming this way.
I'm curious about what happens to the drug in the body. Is it not excreted in the urine? Is it not metabolized and broken down?
It's metabolized in the liver and it can cause liver damage.
Okay.
That's all I know about that, yeah.
I'm sure that it can be found in the blood.
Yeah.
It's just that you have to ask for it.
Well,
There'll
you're
be a
not
lot of
testing for it.
labs that won't have the
The acid.
assays to do it.
Yeah.
Yeah,
So if someone's treated with Narcan and they recover from the immediate danger, they still have it in their system, and you said it doesn't go away, it just accumulates over time?
that's what I've read about it. I don't know, some drugs, take 30 days, 60 days, 2
Well,
days.
You need to know what the half-life is,
Yeah.
but, cause it's not like marijuana.
Right.
It goes into the fat, and that's why it stays for 3 months, but most of these have a half-life, you just need to know what that is. I want to.
So this has anywhere from 2.5 to 9 hours.
Yeah, so that'd be the half.
But chronic users, it can, a terminal half-life could be beyond 24 hours.
Yeah.
Yeah. So I mean, I've seen people eat this whole package in a day.
Oh,
And it does say do not take more than one.
Yeah, I mean, like the quarter habits, I mean, this is what's hot, like, it is so addicting. As soon as
What's it
12
taste
hours.
like?
What's it taste
candy,
like?
tastes like
Does
candy.
it taste like, I
Yeah.
was wondering if
Yeah.
it's
And you
fast.
Is it flavored?
And you get that,
It's flavored, yeah, I mean, I don't know if all of the different kinds are, but the ones that I have, I mean, you can smell it on someone's breath, it's fruity, but it passes quickly. Yeah, yeah, but within 12 hours of not taking it, the withdrawals are convulsions,
Right,
endless
and you-
vomiting, I mean, way more than tremors, like convulsions. Yeah, and your heart's a muscle, so your muscles start convulsing and you're at a great risk. Yeah.
And you get a tachycardia.
Again, it's gonna affect different people differently, because we all have different addiction tendencies, you know, the way that we're wired, but I don't see the benefit. I don't see the benefit of having this out there.
So why is this such, and for me, it's. I didn't know anything about this
My son,
2
Michael.
months ago,
Michael?
you know, I didn't really hear about it 2 months ago or 3 months ago. And if you go back 12 months ago, it wasn't even, I couldn't even spell it,
Right,
but now.
but it's fast, it's coming,
That's the speed of which it's getting.
yeah.
Being put out there as in retailers and being able to sell, because it's available, there's no. You say that it can't be sold for under 21, but why there's no legislation currently in the Commonwealth? around that?
No, who's the distributor?
So this package says that it comes from, I believe it was Montana.
Mhm.
I know a lot of them comes from California,
Right,
American made.
Is it also available for online purchase?
Oh, yes.
Yeah.
Oh,
I
yes.
just looked on Amazon.
It is?
Yeah,
Yeah.
yeah.
Yes.
Yeah, so you just check that box that you're over 18 and now, you know, your high school party's got plenty of drugs at it.
right. And it's those, depending on the dosage you mentioned in earlier.
Right.
It can give you that kind of, speed like,
Yeah. like a
effect, or the, you know, the opioid effect, where you're kind of slow down if you get.
So a lot of psychosis is popping up. I will say that, you know, during this epidemic, what's changed will be a social media now,
Mhm.
right? So people can talk about everything very quickly, which can help us or hurt us.
Yeah.
But I did go on Instagram, and if you put in the products on Instagram, actually underneath a lot of them, the comments are people like, beware, do not take this has really ruined my life, like going on and on about it. And they're marketing it as something aimed at drug users, substance use users, to help them. But they are all even going on like, do not take this as poison. So it's really. Yeah.
Now, what is, if I may ask, what is your age group? What's your demographic?
22.
22, so you just got out of college, or?
Yeah, I'm intention right now.
And do you see that in college? Do you see the use?
There's
in college?
definitely more opioid use in my age group than people think. People think it's all gone, it's just not talked about because they know it's a stigma. And I think we should be more on the offensive than the defense with these things.
What about kratom? Do you see kratom use?
At the hospital, I'm a security guard at BID, we have had people withdrawing from it before, not commonly. Most nurses you ask won't know what you're talking about.
I know that it's true.
What college do you go to?
I mean, I'm.
Bridgewater.
My son goes there too. He's finishing up this year as well. So do you see it's more people like pictures and like Ritalin, stimulants like that?
Yeah, that's for
Yeah.
rampant, yeah.
Yeah.
That's like 1 in 5 probably.
Yeah,
Yeah.
yeah, there's definitely higher usage of that, but I'm sure kratom will be the next thing because
Yeah.
it's cheaper.
And much more dangerous too, I would say.
So if someone comes into the hospital with this addiction ongoing, how are they handled? What's the treatment? Is there any treatment? Are they just sent home?
Well, that's a different sort of question, that's a matter of how does the emergency room flow, but the withdrawal symptoms are just like any opioid there.
Yeah.
So years.
So once the withdrawal symptoms subside, what happens to the patient?
So usually what happens when people come in and they're withdrawing is they check out before they finish withdrawing.
Yeah.
Because it's so difficult. They very, very rarely stay and finish a withdrawal course.
So there's no kind of long-term care that they get?
They have to
Refer
find
to.
themselves a bed, or if they were, you know, willing to stay, they'd have to go into outpatient treatment.
And the other obvious issue is if anybody can buy this online, and I'm sure there's no age check that.
No.
If there is, it's bogus.
Right, yeah.
It's so gas station.
So we always run across a problem when we think about banning anything. Well, if you ban it in the town of Plymouth, what's gonna happen? Are you gonna make a significant dent in the problem? It
I
has
think
to,
that you will, and I'll tell you why, because if you order it online, you're saying they could still order it online. I think that what's happening is people are running out of their drug of choice. But this is their safety net, and they're like, well, I can just run down to the gas station and grab this, and it's gonna hold me over. If they're waiting, 3 to 5 days or something to get it in the mail, it's not the same.
Yeah.
Could they stockpile it? Sure, but hopefully we can, this is just the beginning of our regulating this, and then we can regulate that as well.
And once it's regulated on the state level, which is hopefully what comes
Yeah.
after multiple, towns ban it, then it is actually, there's a mechanism for banning it to be shipped here. Like nicotine, stuff like that, that can't be brought into Massachusetts because of our laws. So.
Is there a state, is there
Amy,
a
we'll-
state effort to get
we'll
that
get to you.
through the legislature?
I don't know if any, I don't think any other state, I'm speaking ahead of myself, I don't know, to be honest, I haven't heard anything about any state.
There are a few states on here, right on the back, but it says sales are prohibited. I don't know if that means that they're able to have it, shipped there or not. But it says that. Looks like Alabama, Arkansas, Indiana, Rhode Island, Vermont, Wisconsin, Tennessee, Arizona, Oklahoma, Utah, West Virginia, and Georgia. I mean, there's obviously
Rhode
something
Island
to
too,
it.
yeah.
There's a lot of people being
That's
affected.
Interesting.
Yeah, yeah.
So can we-
Come on, Massachusetts.
Amy has her hand up. Amy,
Yeah, this
Yeah,
is such a
question.
powerful presentation. I really appreciate everything you've been talking about. And I feel like this is the kind of stuff that when it starts at the local level with the towns starting to ban it, as much as we'll get the pushback of they can go next door, they could go. I feel like this is a statement that I feel I'll be very interested to hear in the forum, but I feel like after listening to such a powerful presentation, I feel really moved to make, have some action from the board. So thank you very much for coming and talking to us.
yeah,
Yeah.
it is.
I know you guys have a lot of things and I didn't get to do the slide. I hope you get to look at the slides as they are, and I hope you I put page numbers in there for you to reference and what's going on. But I do just want to read you one little passage from it because, like I said, I've luckily never been addicted to anything. I've been very lucky in that sense in my life. My son and my daughter from my first marriage, their father, we don't have any contact with him for the same reasons for 20, so I've lost multiple people. So we have experienced firsthand the trickle down effect of this and how even if you aren't the addict, you are forever. Your life has changed forever. But like I said, a lot of this in here is in my sister's own handwriting, but I do just want to read you a poem that she left for us. And we didn't find this until after she had passed away. It actually blew into the middle of the living room floor and my mother found it. And we felt it was worth putting in here. So if you can just bear with me for 1 minute, because I want you to understand that these aren't the people that you don't like in your family or your neighborhood. These are the people that love you and you love them. And once they get stuck, they are in a trap and they cannot get out of it most of the time. So this is called The Ones I Love, and she wrote this for all of us while she was suffering. And it says, the ones I love have watched me leave. The ones I love now have to grieve. Their beautiful faces streaked with tears as they mourn my lost years. The ones I love have had enough. They're tired of watching me kill myself. And in death, there is only truth. They read the pages of my misspent youth. The ones I love have seen my soul. They've watched me slowly lose control. The ones I love believed in me, even as my addiction had me on my knees. So many times they watched me fall, but they never lost faith in spite of it all. The ones I love have watched me hide because I felt so ugly inside. I hope they realize I always cared and I never meant to make them scared. The ones I love have set me free. All of my misery just wanted company. It was almost as if they didn't want to see. There was no resemblance of the girl I used to be. The ones I love will all eventually die, but I went first and so they cry. As they stare into my lifeless eyes, I wish I could have said goodbye to the ones I love. So if that doesn't tell you that she felt like she lost her entire life already before she even passed away, and still felt guilt and shame and sad for the people she was leaving behind. I just cannot imagine, my youngest is 12, I just can't imagine a world where he can just go to like, we just have to do something about this. And that's all I have to say about that.
Well, I could say that thank you, Meg, for,
But Meg has my friend.
Yeah, if it's okay, I'll share. Yeah.
thank you, Meg, for introducing us. And thank you, Katie, for your,
Well, thank
your
you.
presentation and
Yes,
comments.
thank
This
you.
is,
And anything that we can do to help as well, it's just
Well,
all
we
over
will have the-
education and awareness
Yeah.
and
we will
Kate,
have-
Amanda.
that's my sister.
Oh, so both of you did it?
Yes,
Oh,
so I took all of her letters, as I said, and, the ones I could get in her handwriting, I write in her handwriting. But actually, on the day that she passed away, she was at my parents' house and she told me that she really wanted to write a book together so that people could learn from it. So it was about a year after she passed away, we had all of her stuff, and Michael can remember, I just sat at that kitchen table for like 6 months, beginning to end, and just put it all in there and wrote the whole story. And then had a complete panic attack that everyone was gonna know all of her secrets and skeletons, but it had to be shared and put out there. So, yep, so now she got to write her book, and hopefully she helps a lot of people.
It's very powerful
Yeah.
and suggest you to,
absolutely.
you know, to be part of the forum.
Yes,
If you can,
absolutely,
We'll,
sure.
we'll send that information out
Okay.
to you.
Thank you, and you can keep this if you need to.
It's a
pass
powerful message.
Could you forward?
Oh, I was gonna say the same one.
Can you forward that slideshow to me?
Yes.
Yeah.
I wanna see if I can badger Ms. Fry about sending something out about that.
I actually
She's
did the
the-
North and South prom presentation one year
Oh.
with the.
That's
gave
great.
it for all the kids, yeah, so they're familiar.
Yeah, so we have,
I have to go a bit early, but
thanks,
thank you so much.
Charlie.
Thank you.
So Katie, we have, school representatives from both North and South, as part of the Board of Health process. So they are, a channel for feedback to us and in this case, you know, giving them information where they can take and be an advocate within their own peer groups. So it's
Great, yeah.
wonderful.
It's great.
Thanks, Charlie.
Thank you.
I did not get a.
Oh,
Here, you can have, here,
I forgot.
Yeah.
take mine.
Thank you so much.
I
Do you have a PDF of it? I'll take. I
Yeah.
like to like.
Thank you.
Yes, it's on
Yeah.
Amazon, yeah.
Thank you so much. Have a great day.
Thank you.
My gosh, Sharon.
Yeah. This one yours?
Yeah, thank you. Well, I think we went through, our agenda item. I think the last point is an adjournment, so I'll entertain a motion to adjourn.
Thank you so much.
Thank you.
Thank you.
Is there a second?
I'll second.
Okay, first from Dr. Reed, a second from Meg. Questions? Comments? No?
No, I want to
Take the
go
vote.
cry now.
I know, Dr. Reed? Vote?
Oh, no, I said, no, I want to go cry. No, we can go, yes,
Yes?
yes.
We
let's
to
stop.
adjourn?
Yes,
Uh,
let's stop.
Dr. Pochman?
Yes, and I was that close to crying myself.
I was.
I know.
Amy Palmer?
I know, what a powerful presentation. That was amazing. So thank you, Meg, for bringing that in. Yes to the adjournment.
Yeah.
Meg Payne?
Yeah, I only knew like a sliver of
Yeah.
that was, wow, that was amazing.
Yeah, and then myself, yes, we're adjourned. Thank you.
Yep. Thank you,
Yeah, no,
guys.